Sister that is on the line at the moment would like to turn our attention to something else. She's just called in. This will have to be an anonymous call, but we're very grateful for the call. She's a registered nurse and vaccinator and wants to bring attention to queue jumpers at this particular time. Sister, welcome to Breakfast with Refilwe.
Hi, good morning.
Good morning. What are you seeing where you are?
The queue jumping is happening, and it's absolutely rife on most sites because people can do it, whilst the Western Cape Department of Health has set out particular guidelines and protocols that people should not queue jump. Most suburban and Atlantic seaboard families are going to sites that are not allocated for them and no times for them given, and getting their vaccinations because they're not being turned away.
Sister, can you indicate which sites where this is happening?
Well, Lenterfear seems to be the site of choice,
yes.
And Khayelitsha, Brooklyn, I think it's happening all over. But, this is nothing new. During the Sisonke trial, whilst there were appointments for your GPs and nurses, it was done on a big scale where the GPs got preference and they got appointments.
Yes.
But, they also brought in their wives and their grannies and their family members. So whilst everybody's outraged at what's going on at the moment, it's been going on all the time. So why did they think that it was going to work in an orderly fashion? I don't understand.
So so at the end of the Sisonke trial, of course, they widened the definition of frontline health worker to any health worker or anyone affiliated to health, right? Because they had a couple tens of thousands of jabs left, and they just needed to get them out before that hard deadline of 15th of May. And what it opened up was a glitch in the EVDS registration system. Yesterday, today's Wednesday. Monday, the government, the Department of Health said that they've closed that health care registration link to try and prevent the queue jumping by people who shouldn't be getting it. But are you saying to me, sister, that it's not even with an SMS in hand or a voucher from the registration site that people are jumping the queue?
Absolutely. They roll up at vaccine sites, they sit in the queue, they produce their ID cards, and they get vaccinated. And whilst I have patients that are in their 80s and 90s that are sitting around like good, honourable citizens that have registered on the system, are being left behind because they're independent living elderly people that certainly aren't able to frequent one of these vaccine sites.
Yeah.
And I just find the whole system totally unfair. When you have a 92-year-old couple that can't get to one of these vaccine sites, how are they ever going to have faith that they're going to not be overlooked?
Particularly when they're waiting their turn. Now, in about 6 weeks' time, they're going to need to come back for a second jab. What will happen to those queue jumpers?
They've already got their vaccine cards with their for their next vaccine.
So they will appear as legitimate wherever they go.
Exactly.
Yeah.
So this whole system is flawed, and whilst medical aides are trying to procure sites to vaccinate their members, it's not happening. And people don't have faith in the system, so that's why they're frequenting the vaccine sites.
Yeah. Do you have a concern, or do you feel that we're at risk of not getting enough jabs and arms? So putting the moral argument aside, are you at least relieved? And I'm not trying to undermine how bad what the queue jumpers are doing is, but do you feel that it's probably for the best to get more jabs and arms, and it would be better if we could?
Absolutely, of course I do, but I think it needs to be done in a systematic fashion.
100%. And that.
The more jabs and arms we can have, the better, because obviously it's to every single person's benefit that there is herd immunity at the end of the day.
Just last question for you then. You are actually on the ground, sister. You are doing the vaccinating. You see how long a day it takes to get people through. What would you prefer? Abandon the SMSs altogether and just encourage people to come at the risk of course, sometimes not having enough vaccines? Maybe you give everybody a number up to 400 and say we only have 400 for the day and everybody else goes home. Or would you prefer that we tighten the registration system?
I think...
You're fading there, sister, if you can move your handset.
Thanks. But I really believe that if people are queue jumping, then let's have it free for all and give a number system and let everybody rock up at a site and wait your turn. Let them announce at the beginning of the day there are 500 vaccines at the site and how many people are around and the rest must go home.
Correct. Thank you, sister. Very much appreciated. Good luck for the rest of the day.
Thank you.
All right then.
Breakfast with Refilwe on Cape Talk.